Alright, so introducing myself. Knock, knock, knock. Hello, Mr. Jones. Can you tell me your name and date of birth? And I'm looking at his armband and I'm looking at his date of birth. Okay. My name is Shonda. I'll be your nurse for today. And the doctor has ordered for you to get an NG tube, or a nasal gastric tube. The whole purpose of the tube is to help with any nausea, is to help with a small bowel obstruction, to help relieve that obstruction in your belly. Now what this tube is going to, how we're going to insert this tube, we're going to insert it through your nose and we're going to thread it through your esophagus to your stomach, okay? The procedure is not, it's not a lot of pain, but you will feel some discomfort, okay? Is it okay if I do that procedure on you? Alright, so I'm going to go ahead and I'm going to clean my hands and provide for privacy. And then let me bring all my supplies near me. Now, I'm going to raise your bed up and I'm going to sit you up. Mr. Jones, have you ever had any septal deviation? Have you ever broken a nose or have any congestion or sinus problems? Alright, I'm just going to sit you up. Sit you all the way up. I'm also going to, let's go ahead and put some gloves on. I'm also going to put your pillows behind your back. That way you're sitting up straight. Because I'm going to ask you to help me for you to swallow, to help the tube to pass through easy. Okay? So I'm going to set you up. Put the pillows behind your back. Perfect. Alright. I also would put a towel across my patient just in case if my patient vomits. I'm protecting, not getting the patient messy. So I'm going to get my tape ready. I'm going to grab a few pieces of tape. You want to cut 3 strips of tape. And you can set them at your bedside. 1 strip you will make into tape pants. Okay? And I'll explain the purpose of the tape pants. So what I'm going to do is take my piece of tape and I just split it down the middle. And it makes it look like little pants. Okay? So I've assessed his nares. I'm going to have the patient breathe through his nose. Okay? Then I'm also going to assess my patient's gag reflex. So I'm going to take a tongue depressor. And Mr. Jones, I'm going to ask you to say ah while I press down on your tongue to check your uvula. So say ah, ah. Okay, so I was able to see his uvula. He did cough once I pressed that tongue depressor down his throat. Okay, so I know that he has good gag reflex. Okay. I'm also going to go ahead and take a listen to his bowel sounds. I'm going to raise your gown, starting in right upper quadrant. And y'all would listen for a full minute. If I didn't hear any bowel sounds, I would listen for 5. Okay. And so I don't hear hypoactive bowel sounds. So we're going to measure your tube. And the way we will measure, because this is not a sterile procedure, just using gloves is fine. I'm going to measure from the patient's tip of his nose to his earlobe. And I'm going to hold there and bring it down to about where I guesstimate where his xiphoid process is. So about right there. Okay? So I'm going to take a piece of tape and mark where I'm going to stop. This is where I'm going to stop inserting the NG tube, okay? And you don't have to have this much tape. Your NG tube will come in a bag, so I am going to place my NG tube right on top of the bag. And I'm going to lubricate my tube. I'm going to simulate this. And you want to lubricate enough to get all the notches lubricated. So if you can see on the tube how it has notches inside of it, you want to make sure that it's lubricated. Okay? That's going to help with patient comfort with getting your tube in. Alright, Mr. Jones, I'm going to hand you a cup of water. Okay? Once I get the tube past your nose, also known medically nasal pharynx area, I'm going to ask the patient to swallow. Okay? So I'm going to use his right nair. Okay? That was his best choice to use, and I'm on his right side, so it's going to be easy for me to use that side. Okay. So you're going to feel a little pressure here, okay? Here we go. And once I get it past his nose, I'm going to start to twist. And then I'm going to have the patient flex his neck. Okay? Now I'm going to ask Mr. Jones to take some deep swallows to help me pass this tube to go to his esophagus, to his stomach. Okay? While I'm pushing this tube in and he's swallowing, I'm checking his respirations, chest rise and fall. I'm also checking to make sure the tube is not coming out of his mouth. You may have to twist it if you have trouble getting it in. Okay, so I got it in. I'm going to hold there. Okay. Now I'm going to check for placement. He's breathing okay. I don't see the tube coming out of his mouth. So I'm just going to hold there, having to hold still.
Hey Judy, this is Katie.
I'm going to pull back no more than 10 cc's of air. And attach it to my tubing. Lay that there. And I'm going to auscultate his bowels. What I'm going to do is I'm going to push air into the tube, and I should expect to hear air pass through the tube in his bowels. Okay? So anywhere on his abdominal region, I'm going to place my stethoscope, and I'm going to push a little bit of air. You should hear a swishing noise. So swoosh. Okay? So that's one assessment I can do to determine that it's in the right place. The other assessment I need to do is I'm going to aspirate, and I should get GI contents come through my tube. And once I aspirate, I'm going to use a pH card. Go ahead and clamp this so that it doesn't spill out on your patient. I'm going to use a pH card. And I'm going to apply my strip. You have a little strip, and I'm going to put my contents on the strip. And my pH should be between 3 and 6. Okay? That also lets me know that I'm in the right place. My other way I can check for placement is I can do an abdominal x-ray, and my abdominal x-ray will tell me if I'm in the fundus. Okay. So now what I'll do is I'm going to secure his tube. So you're going to use your tape pants, or if you have an NG tube holder, you can do the same thing. I'm going to lay the flat surface of the tape on his nose, and then just wrap my tape around the tube. And that way, this will help secure it and keep it from moving. Okay, so that's secured. I'm going to go ahead and also secure my tube to my patient's gowns. There's two different ways you can do this. You can take a piece of tape, your third piece of tape that you have left over, and loop it and tape it on the patient's gown. Or you can take a safety pin. If your hospital policy allows safety pins, you can take the piece of tape, loop it on the tube, and then stick the safety pin on the gown. That way, if you have tension on the tube, the tension is on the gown and not the tube. Okay? So I'm going to hook this up to low wall suction. So I'm going to use my connector piece. To low wall suction. So I got that hooked up. I'm going to turn it on and then turn it to low wall. Okay, I'm going to note how much comes out of my suction canister. Okay, Mr. Jones, are you doing okay? Alright, we're all finished with putting in your tube. Okay, I'm also going to when I talk to my nursing assistant, remind her to keep the patient's head of the bed at least 30 degrees at all times while he has an NG tube. If I use the NG tube to give medications or feedings, I will hold my suction for at least 30 minutes so that the patient can absorb the food or medication that we're giving. Okay, so I've lowered his bed. I'm gonna lay him back. Take this cup and let's put your pillows back. Okay, we'll clean up my mess. Make sure bed rails are up and call light is within reach. Take off my gloves. Clean my hands. Alright, you think you need anything? Alright, I'll be back to check on you, okay? Alright, and so when I document, I want to document that I performed the procedure, patient tolerated the procedure, respirations were normal, chest rise and fall was normal. I also want to document how much of the tube that I put in, okay? And you have little markers on your tube that'll tell you how many centimeters the tube is down. I also want to document that I used an assessment to determine that I'm in the right space, whether it is an x-ray or pH testing, or if I did it by auscultation. And then last but not least, I need to document the color, consistency, and amount of drainage that came from the NG tube from the patient's stomach. All right.